Hey, stop what you're doing right now, because what I'm about to share could genuinely protect your brain while you sleep tonight. And I say that not to frighten you, but because most people spend 1/3 of their entire lives sleeping, and almost nobody thinks about whether the position they sleep in might be affecting their cardiovascular and neurological health. Let me invite Dr. Benjamin Carter so that he can explain better.
I'm Dr. Benjamin Carter.
26 years of experience studying the relationship between sleep, cardiovascular function, and stroke risk. And what I've discovered through reviewing research from multiple major institutions is that sleeping position, something most people never give a second thought, may have meaningful implications for cardiovascular and cerebrovascular health during sleep. Now, before we continue, I want to be completely clear. This is general educational information only. This is not medical advice. If you have any cardiovascular concerns, history of stroke, or any health conditions, please consult with your qualified healthcare provider. What I'm sharing today is information about what some research suggests, not a diagnosis or treatment recommendation. With that said, the research connecting sleeping position to cardiovascular and cerebrovascular health is genuinely fascinating and increasingly important. Today, I'm going to walk you through 5 sleeping positions and what some research suggests about their potential effects on cardiovascular and cerebrovascular health during sleep. Ranked from least concerning to the position that some research suggests may be most worth discussing with your doctor. And I want to tease something right now. Number 1 on this list is the sleeping position that most people assume is perfectly safe. In fact, it may be the most commonly used sleeping position in Western countries. And some research suggests it may be worth a careful conversation with your cardiologist. So please, watch this to the end. The information builds. Each position connects to the last. But before we begin, I want to ask you something personally. Leave a comment below and tell me this. What position do you typically sleep in? And have you ever discussed your sleeping position with your doctor? I read every single comment, and your answers shape what I cover next. Okay, let's get into it. Starting with number 5.
Number 5, left side sleeping. Number 5 is a sleeping position that some research suggests may actually be among the more favourable positions for cardiovascular health, with some important nuances worth understanding. I'm talking about sleeping on your left side. Now, left side sleeping is commonly recommended during pregnancy for improving circulation. But here's what some research suggests about left side sleeping for adults generally, particularly older adults with cardiovascular concerns. Some research has explored how left side sleeping affects heart position and function during sleep. Because the heart is positioned slightly to the left in the chest, sleeping on the left side means the heart is essentially resting against the chest wall rather than suspended in its natural position. Some studies have suggested that this positional change may be associated with certain changes in cardiac electrical activity, detectable on EKG, in some individuals. Some people report increased awareness of their heartbeat or mild palpitations when sleeping on their left side. Additionally, some research has explored whether left side sleeping affects the lymphatic system and certain digestive processes differently than other positions. However, and this is important, other research has suggested that left side sleeping may have benefits for some people, including potentially improved circulation and reduced acid reflux. The research is genuinely nuanced and not definitive. For most healthy adults, left side sleeping is generally considered acceptable. But for adults with certain cardiovascular conditions, the nuances of left side sleeping may be worth discussing with a cardiologist. What to discuss with your doctor? If you sleep on your left side and experience heart palpitations, increased heartbeat awareness, or discomfort, mention this to your cardiologist. Ask whether your specific cardiovascular situation makes any sleeping position preferable. Synergy tip for number 5. Some research suggests that using a body pillow to support your position during sleep may help maintain consistent positioning throughout the night and reduce positional changes that can disrupt sleep quality. That's number 5. But number 4 involves a sleeping position that millions of people use specifically because they believe it's heart healthy. And the research is more nuanced than most people realize. Let's talk about it.
Number 4. Elevated head sleeping. Number 4 is a sleeping position that is commonly recommended for various health conditions, but that has some nuances worth understanding from a cardiovascular perspective. I'm talking about sleeping with your head significantly elevated, either through multiple pillows or an adjustable bed that raises the upper body. Head elevation during sleep is commonly recommended for acid reflux, sleep apnea, and certain cardiovascular conditions. For many people with specific medical indications, it provides genuine relief and benefit. But here's what some research suggests about the nuances of head elevation for cardiovascular and cerebrovascular health. Your brain receives blood through a constant, carefully regulated flow. When you sleep flat, your heart and brain are at roughly the same level, which requires relatively modest cardiovascular effort to maintain cerebral blood flow. When your head is significantly elevated during sleep, your heart must work slightly harder to pump blood upward against gravity to reach the brain. For most healthy adults, this difference is negligible. But for adults with certain cardiovascular conditions, particularly those with low blood pressure, cardiovascular insufficiency, or certain types of heart failure, this positional change may affect cerebral perfusion during sleep. Some research has explored the relationship between head position during sleep and cerebral blood flow in older adults. Some findings have suggested that in certain populations, particularly those with existing cardiovascular compromise, significant head elevation during sleep may be associated with changes in cerebral perfusion that could potentially be relevant to cerebrovascular health. Additionally, some research has explored how head elevation affects the glymphatic system, your brain's overnight waste clearance mechanism. Some findings have suggested that optimal glymphatic function may occur at specific head positions during sleep. What to discuss with your doctor? If you sleep with significant head elevation, ask your cardiologist whether this positioning is specifically appropriate for your cardiovascular situation. Ask whether your blood pressure has been evaluated in different positions and whether your current sleeping position is optimally aligned with your cardiovascular health needs. Synergy tip for number 4. Some research suggests that a modest elevation of approximately 10 to 15 degrees rather than extreme elevation may provide benefits for conditions like acid reflux while minimizing potential effects on cerebral perfusion. Discuss the optimal elevation angle for your specific situation with your healthcare provider. Number 4 is important, but number 3 is where things become genuinely fascinating. And if you're finding this valuable so far, this is a good moment to hit that subscribe button and give this video a like. I release evidence-based cardiovascular health education every single week, and your support makes that possible.
Number 3, stomach sleeping. Number 3 is a sleeping position that some research suggests may have several health implications, and that is particularly worth discussing for adults over 60 with cardiovascular concerns. I'm talking about sleeping on your stomach, face down, prone position. Stomach sleeping is relatively common. Some people find it comfortable. But here's what some research suggests about its potential cardiovascular and cerebrovascular implications. When you sleep on your stomach, your neck is typically rotated significantly to one side for extended periods. Some research has explored whether prolonged neck rotation during sleep may affect blood flow through the vertebral arteries, the arteries that run through the cervical spine and contribute to blood supply to the posterior brain, including areas involved in balance, coordination, and certain cognitive functions. Some case reports and research have explored associations between prolonged extreme neck rotation and cerebrovascular circulation, the blood supply system to the posterior brain. In most healthy adults, this circulation has sufficient redundancy to compensate for positional effects. But in older adults with existing arterial changes, the margin for compensation may be reduced. Additionally, stomach sleeping places the spine in an unnatural position that some research suggests may affect the quality of sleep, particularly deep sleep stages, which are critical for cardiovascular and brain health. Some research has also explored how stomach sleeping affects breathing mechanics. The prone position may make it slightly more difficult for the diaphragm to move freely, potentially affecting breathing quality during sleep in some individuals. What to discuss with your doctor? If you are a habitual stomach sleeper and are over 60, mention this to your doctor, particularly if you have any history of cervical spine issues, cardiovascular concerns, or risk factors for cerebrovascular disease. Ask whether transitioning to a different sleeping position might be worth considering for your specific situation. Synergy tip for number 3. Transitioning away from habitual stomach sleeping can be challenging. Some sleep specialists suggest using a body pillow placed alongside your body to make side sleeping more comfortable and to discourage rolling onto your stomach during sleep. Number 3 is significant, but the next two are where things become genuinely important. Number 2. Right side sleeping with unmanaged sleep apnea. Number 2 involves a combination of sleeping position and an underlying condition that some research suggests may be particularly relevant to cardiovascular and cerebrovascular health during sleep. I'm talking about right side sleeping in adults with undiagnosed or unmanaged sleep apnea. Now, right side sleeping on its own is generally considered one of the more neutral sleeping positions for most adults. For many people, it is perfectly acceptable, but here's where the research becomes specifically important. Some research has explored how sleeping position interacts with sleep apnea, the condition where the airway partially or completely collapses during sleep, causing repeated breathing interruptions and oxygen drops. Some studies have suggested that sleep apnea events, moments when breathing stops and oxygen drops, may occur more frequently or more severely in certain sleeping positions in some individuals. The relationship between sleeping position and sleep apnea severity varies between individuals and depends on the specific anatomy of their airway. But here's the critical cardiovascular connection. During sleep apnea events, oxygen levels drop. Your body responds with a stress response, releasing adrenaline, elevating blood pressure, increasing heart rate. Some research has explored associations between repeated nocturnal cardiovascular stress from sleep apnea and increased risk of cardiovascular and cerebrovascular events. Some research has suggested that the overnight blood pressure surges associated with sleep apnea events may be relevant to stroke risk, particularly in the early morning hours when stroke incidence is statistically higher. And here's what makes this especially significant for adults over 60. Some research suggests that sleep apnea prevalence rises substantially with age. And in older adults, the cardiovascular consequences of repeated nocturnal oxygen drops may be more clinically significant than in younger, healthier individuals.
I had a patient, Raymond, 69 years old, from Vancouver, a retired accountant for a routine.
He mentioned almost as an aside that he always slept on his right side and woke feeling unrefreshed. His wife had noticed occasional snoring. His morning blood pressure readings were consistently higher than his evening readings, a pattern sometimes called non-dipping that some research associates with sleep-disordered breathing.
When we arranged a comprehensive sleep evaluation, Raymond was found to have moderate sleep apnea. With appropriate management through his sleep specialist, his morning blood pressure pattern improved significantly over several months. Raymond told me, "I didn't think my sleeping position or my snoring had anything to do with my heart. I had no idea they were connected." What to discuss with your doctor. If you sleep on your right side and experience morning headaches, unrefreshing sleep, or your partner has noticed snoring or breathing pauses, ask your doctor specifically about sleep apnea evaluation. Ask whether your morning blood pressure readings are being specifically compared to your evening readings and whether the pattern is clinically significant. Synergy tip for number 2. Monitor and record your blood pressure both in the morning immediately after waking and in the evening before bed for 2 weeks. Share this pattern with your cardiologist. Some research suggests that the morning to evening blood pressure pattern may provide valuable information about cardiovascular health during sleep. This is number 2, and it is important. But what I'm about to share for number 1, the sleeping position that most people assume is completely safe and that some research suggests may be worth the most careful consideration, this is what the research has been quietly building toward. This is the one. Number 1, flat back sleeping in adults with specific cardiovascular risk factors. Number 1 is the sleeping position used by a significant proportion of adults, particularly older adults, who have been told it is the healthiest position for their spine and joints. I'm talking about sleeping flat on your back, the supine position. Now, for many healthy adults, back sleeping is perfectly acceptable. For some people, it is genuinely the best position. This is not a blanket statement against back sleeping, but here's what some research suggests about flat back sleeping in older adults with specific cardiovascular risk factors, and why it deserves the most careful consideration of all 5 positions. Here's the mechanism. And I want to explain this carefully because it is genuinely important. When you sleep flat on your back, gravity acts uniformly on your entire body. For most healthy adults, this is fine. But several specific changes occur in the supine position that some research suggests may be relevant to cardiovascular and cerebrovascular health in older adults with existing risk factors. First, the supine position is associated with the highest rates of sleep apnea events in most sleep apnea patients. When you lie flat on your back, the tongue and soft tissues of the throat are more likely to fall backward under gravity and obstruct the airway. Some sleep specialists call this positional sleep apnea, where breathing events occur primarily or exclusively in the supine position. Second, when you sleep flat on your back, venous blood return to the heart changes compared to side sleeping. Some research has explored how this affects cardiac preload, the amount of blood filling the heart before each beat, and how these changes interact with various cardiovascular conditions in older adults. Third, and perhaps most importantly, from a cerebrovascular perspective, some research has explored how the supine position affects the glymphatic system, your brain's overnight waste clearance mechanism. A study published by researchers at the University of Rochester suggested that the glymphatic system may function differently in different sleeping positions, with some research suggesting that certain positions may be associated with more efficient clearance of metabolic waste products from the brain, including proteins associated with neurodegenerative conditions. Fourth, some research has explored the relationship between the supine sleeping position and nocturnal blood pressure patterns in adults with hypertension. Some findings have suggested that certain blood pressure patterns during supine sleep may be associated with cardiovascular risk markers. And here is a statistic that makes this number one. Some research has explored the timing of cardiovascular and cerebrovascular events. Stroke and cardiac events show a well-documented statistical peak in the early morning hours, roughly between 6 and 10 a.m. Some researchers have explored whether the physiological changes associated with prolonged supine sleep, including sleep apnea events, blood pressure patterns, and oxygen dynamics, may contribute to this morning vulnerability window.
All of the research referenced throughout this video is linked in the description below. I encourage you to read it. Share it with your cardiologist. Ask the questions that your appointments often don't leave time for. Here is what I want you to hear as we close. Sleep is not passive. Your cardiovascular system is active throughout the night, regulating blood pressure, maintaining cerebral blood flow, clearing metabolic waste, repairing cellular damage. The position your body is in during this critically important time may matter more than most people ever consider. You are not powerless here. You are not at the mercy of your cardiovascular risk factors. You have information now that most people never receive, and that information gives you the ability to have a conversation, a specific, informed conversation, with your cardiologist about whether your sleeping position is optimally supporting your cardiovascular and cerebrovascular health, whether you are 60 or 85, whether you have multiple cardiovascular risk factors or relatively few, whether you've been sleeping in the same position for decades or you're open to change. This conversation deserves to happen. These 5 sleeping positions, left side sleeping, elevated head sleeping, stomach sleeping, right side sleeping with unmanaged sleep apnea, and flat back sleeping with specific cardiovascular risk factors are not reasons to panic. They are reasons to have an informed, proactive conversation with your healthcare provider. Don't let anyone tell you that how you sleep is too trivial a detail to mention to your cardiologist. The research says otherwise, and so do I. If this video helped you, please subscribe to this channel and share it with someone you care about, particularly someone over 60 with cardiovascular risk factors who has never thought about their sleeping position. Every week, we go this deep into evidence-based cardiovascular health education, and your support makes that work possible. And now I want to hear from you. Which sleeping position surprised you most in this video? And what position do you typically sleep in? Leave your answer in the comments. I read every single one,